Medurstand. Understanding medicine.
Professor Aziz Rehman from Medurstand, and today we are going to demonstrate the clinical methods in GIT, how to examine gastrointestinal system. But now I am going to demonstrate the method of palpation of lower edge of the liver, and this is the task you are often given in the examination. You know, the lower border of the liver coincides with the lower costal margin. You know, liver is in the right side and it is mostly under the costal margin, and only the lower edge can be felt here. Maybe the left lobe can be felt in the epigastrium, but we examine here almost on the mid-clavicle line. So I would put my hand here because liver could be enlarged and the lower border could be displaced downward. So I will start somewhere here. So the technique is you press it like this and then you make a movement like this. So purpose is that you try to feel the lower edge of the liver with this part of your finger. So I press it like this and do this movement, this scooping movement and this, and when I approaches the lower border, I will ask him to take a deep breath also. So one characteristic feature of liver is that it moves downward because it is in contact with the diaphragm. With every inspiration, diaphragm moves downward, so will also be liver, and you can feel the lower edge of the liver moving downward. So this movement I will keep doing and I'll move upward like this. सांस ले जरा, सांस ले, लंबा सांस ले. Okay, yes, I can feel it. लंबा सांस ले, yes. Okay. So once you feel the liver, the lower edge, you of course notice many things. If liver is tender, if liver surface is irregular, if there are any pulsations, all these things are to be noted, and what is the consistency of the liver. But one important thing is that you define the anatomical area where the lower border is felt. So in this patient it is felt here, so it corresponds to the lower costal margin, which is normal. So if it was palpable like here, then I would describe it as like 2 fingers below the costal margin, and you have to count from, I think, mid clavicular point here. So 2 fingers or 3 fingers below the costal margin. So this is how we describe. But one very important thing is, what we have found is that liver is palpable, the lower edge of the liver is palpable 2 fingers below the costal margin, but we are not sure if it is displaced liver or if it is clearly actually enlarged liver. So to differentiate between displaced liver and enlarged liver, you need to percuss the upper border of the liver, because upper border of the liver is behind this chest, the ribs, so you can't actually palpate it. You have to do that with percussion. Now let me demonstrate how to percuss the upper border of the liver. Only then you will be actually able to determine the total span. So I would start somewhere here, put my finger in the intercostal space, and with my other hand I will percuss like this. I actually use 2 fingers. You could use 2 fingers or 1 finger, the way you feel comfortable. I use 2 fingers like this. It is resonant because it is lung, come down, again resonant, resonant, here it has become little dull. So this is how this corresponds with the upper border of the liver. Upper border of the liver is horizontal, lower border is oblique. So when you determine the upper border and then you have already determined the lower border, then you can measure the span. If you have a measuring tape, you can measure the total span. So total span will actually tell you if the liver is enlarged or not. When somebody has emphysema, when you are palpating, the liver would be displaced downward, but when we percuss from here, the percussion node will remain resonant till a very, very low level like 8th, 9th or 10th intercostal space. So then we'll see The liver is actually not enlarged, it is only displaced. So this is how to palpate the liver. And if you have hepatomegaly, then you will be asked the causes of hepatomegaly. You will also be asked about causes of tender hepatomegaly or the hepatomegaly with pulsation. So all this differential diagnosis you need to know.